Hi everyone, we're back at the Arthritis Broadcast Network booth for a #CR Arthritis event, and we are so happy to have Marie Westby here with us today. Could you tell the audience a bit about yourself and how you're involved in rheumatology?
Sure, and thanks. It's a privilege to be part of this again this year. So my background is in physiotherapy, and I got started in rheumatology in my very last clinical placement, which was at the Mary Pack Arthritis Centre here in Vancouver. And I loved it so much that back then you could actually just ask for a job, and they gave me one with no interview. And that was 30 years ago. So I've been working clinically at the Mary Pack Arthritis Centre for 30 years. And then because clinical work leads to a lot of questions about care and gaps in care and research questions, I went back to school as a mature student and decided to do a PhD in more research so I could start to answer some of those questions I had as a clinician.
Mm-hmm. Interesting. So would you be able to tell us about some of the research that you're doing right now?
Sure. So today, or actually yesterday at the conference, I presented a poster on a study I'm doing to develop, I've developed quality indicators, which are what we call measurable aspects of care around sort of what is the minimal standard of care people should expect to receive if they're going to be having a hip or knee replacement.
Okay.
So hip and knee replacements are really common in Canada. The number are going up. There's over 100,000 people a year that have hip and knee replacements, mostly for osteoarthritis, but also for rheumatoid arthritis and other inflammatory arthritis. And right now, depending on which province you're in and which hospital you have it at, even which surgeon you have, you get offered very different preoperative care in terms of getting ready for your surgery and very different postoperative care. And some of it's around what's available, resources, what's feasible, how that province funds rehab. But it's not really, hasn't been traditionally to any great extent based on sort of the research evidence to support it. So I really wanted to look at increasing the consistency and the quality of rehab care so that, one person wasn't getting a Cadillac program and then their friend down the street who had a different surgeon at a different hospital was only offered 2 or 3 visits. That didn't seem fair. So I developed these indicators that are based on high quality research. And we did what they call a Delphi survey, which is a formal way of developing consensus amongst a number of experts.
Okay.
We did that a couple years ago across Canada with orthopedic surgeons and physical therapists, patients, people who've undergone hip and knee replacement, and different health professionals. And they agreed on a set of just over 60 indicators, about half for hip replacements and about half for knee replacements, that would take people through the whole, what we call continuum of care. So in Canada, we have significant waiting times. You may be deemed a good candidate, as they say, for a hip or knee replacement, but then you often wait 6+ months. So that's a great opportunity for getting ready for your surgery. And as a physiotherapist, I see it's a great opportunity to get fit, to start to do some exercise and prepare for it. So these indicators reflect that preoperative phase in terms of what people can do and what prehab, we often call it, should look like. What should happen in that ever-shortened hospital stay, which is anywhere now from, they're actually looking at same-day discharge in some places, to maybe 3 to 4 days of hospital stay. And then people see it as almost a year of post-operative rehab that they need to commit to doing exercises. So today, and at this conference, I was presenting my work on a survey that I did across Canada with patients. So people who had had a hip or knee replacement in the past year or were waiting for one, and finding out what they wanted in a toolkit. So these quality indicators were designed to improve the quality and consistency of care, but I don't want just clinicians and orthopedic surgeons to have this information. I want the people who are going to have hip replacements. So not only will clinicians hopefully know where is the evidence to support different types of care, but patients can ask for that. They also know what they should ask for, what they can expect in terms of care. And so I surveyed them to find out what they wanted in this toolkit.
That's great, because patients are, of course, equal members in their healthcare, and they should be equal members in their healthcare, as I know this conference has spoken a lot about. So.
And I wanted them to have the confidence. The toolkit for patients will be called EQUIP, EQUIP, TJR. because I want to equip them with
That's
the
great.
knowledge, the skills, and the confidence to ask questions.
Yeah, to empower them.
To empower them, yeah. And so they feel confident that actually, you know, maybe I should have my balance assessed before I'm discharged from physio, and how to have that conversation with their therapist and to know what kind of balance tests maybe they should have, and why balance tests are important, because there's still that increased risk of falling after a joint replacement. So we asked them what kind of resources they would most like to have access to in the toolkit. And the top resources that they identify were actually print or paper-based resources, because the patient population, the largest part of our sample were 55 plus. I'm almost in that category. And we, you know, people like paper to be able to take notes, take them with them from visit to visit.
Even myself, I like paper.
Still print things out, So they wanted checklists and information embedded in educational booklets that they're already receiving, questionnaires. There's some interest in a little, like, small pocket-sized passport that they could literally put in their pocket, carry around, sort of track their care, check off things if they have questions in that.
That's really great. So how long do you think it'll be until there can be this sort of standardized quality of care sort of nationally? I know that's
wow, that's the global. So that will take me through to retirement. The first thing we need to do is to be able to show, hopefully, that by improving the quality of care, and if people use the toolkit, if it helps them to deliver better care, that results in better outcomes. And outcomes might be things like, obviously, shorter recovery, being able to return to work sooner, being able to get back to sports, better quality of life. There's a number of different measures that we can use. So before provinces or funding bodies or hospitals are going to adopt these, we need to show them that there's a benefit. Because often it might mean a small change in practice, and any change in practice is difficult, especially when you've got systems in place to do it a certain way. So often, I think we're looking at least 5 years out. I'm starting locally, obviously, here in the greater Vancouver area to look at implementing it and see what impact. And if it's successful, then part of my sort of sustainability or long-term plan will be to try to roll it out across Canada.
Yeah, that's great. That's, as a patient, that's really, really wonderful. So another sort of topic of this conference has been digital health and social media. And how does that relate in terms of quality of care, or even your other work as a physiotherapist?
It's interesting. We asked, as part of the survey, we asked how many people are using social media, how many people are using smartphones, because again, it's a bit of an older patient population, and we wanted to know if people wanted an app. We also wanted to know how they wanted to hear about this toolkit. And again, the majority wanted it through pretty traditional means. So they wanted it as a brochure in their surgeon's office or their doctor's office. Some of them wanted it posted maybe in a consumer magazine, like Maclean's, or I think it was Zoomer magazine. But there were a proportion, we were just looking at that data now, that certainly thought through Facebook, through Twitter. This population, I think, uses more Facebook than Twitter, so we'll be looking at that, and I'm working with arthritis consumer experts, obviously, to get some great advice on that whole social media approach, because one of the largest, growth in proportion of people going after a hip or knee replacement is the under 55 age group. Now, they make still up a very small proportion of people who are having them, but in terms of the rapid increase in the number or the percentage or proportion, that much younger and the much older age group, and of course the much younger population, are using more social media. So I think that will be an avenue. I think maybe just right now it won't be our priority, but I think within 5 years we're going to need to use that more.
But you know what, it is important to consider it when everything's moving towards, you know, digitalizing all of the information. It's important to consider that, you know, some age groups, some populations, that might not actually be the ideal method of receiving information. So that's, I'm hoping the toolkit will have a bit of everything for everybody, whether it's print or video or it can be, I mean, one of the ideal situations would be to develop a product that's a digital product that can be embedded into electronic health records. So a lot of provinces, a lot of hospitals have these electronic health records where the information can just be part of that, and it's easy to check off boxes and to incorporate it. And that would be the ideal situation. It's part of the care path, and it's right in front of you, so you see you need to do these things. So we hope that will be That's great.
possible too.
And so for some of our viewers who may be patients, possibly considering getting a joint replacement, knee, hip replacement, what are some things, maybe some advice you would have for them, some things they could do before entering a surgery?
Well, I think the most important thing is to stay as active as possible, and that's hard. If you need a hip or knee replacement, you're in a lot of pain. You have a lot of limitations in terms of your ability to be active in sports or even walk any great distance. But when we did focus groups a few years ago with people who were waiting for joint replacement or had recently gone through them, they said the most valuable thing that they felt they could do was to prepare and get fit as possible prior to surgery. So that prehab phase that we often call it, even strengthening your arm muscles because you're going to be using walkers or crutches or leaning on your arms a lot more, putting in the time to do a fitness program. Maybe it's going to a pool where you can take the load off your hip or knee joint. And so being as active and as fit as possible prior to surgery, it makes the recovery a little bit faster. You're also used to exercising, which as a physiotherapist, I'm going to make you do after your surgery. So the whole concept and some of the terminology around strengthening and sets and weights and repetition, it becomes more familiar. And you can do that. And I recommend the quality indicators that I was speaking of. Our recommendation is that you put in at least an 8-week program to give your muscles time to actually train and get stronger if you want to actually see an effect. So, I mean, obviously exercise in that sense, but also the education, preparing. The more informed you are, the more you know about the surgery as much as you want. Some people like to look at it online. Others don't want to see that, and it's just tell me what I need to do. But to whatever level you want to know is to inform yourself so you know what questions to ask.
Yeah, absolutely. And so for other patients that, arthritis patients who may not be considering surgery, but for them, can you explain sort of the significance of physical activity on their disease?
Sure. I think there's been now probably for the last, coming up on 40 years, a growing body of evidence to show that physical activity and exercise are like a key component of the overall treatment or management of arthritis. When I started practicing 30 years ago, we were a little cautious. We certainly gave people strengthening exercises and range of motion to keep joints mobile and that, but we were a little cautious around aerobic exercise or any high intensity. But then the literature just kept coming out positive that showed that even higher intensity exercise that we would all, aim for. A lot of us don't meet those guidelines, me included, but that those guidelines also apply to people with arthritis, whether it's inflammatory arthritis or osteoarthritis and they're waiting for a hip or knee replacement. So as a physiotherapist, I try to work with people seeing where they're at on that sort of that physical activity continuum from very sedentary, sitting and watching the Olympics for long periods of time, to very active, if not more, too active. And trying to just shift them so they have, they feel confident in being active, and just gradually move up that physical activity continuum.
Yeah, that's great. And I hear that there is sort of, you have a new initiative sort of beginning for physical activity. Can you tell us
thanks.
about that?
So it's called PASCI, or the Physical Activity Support Kit Initiative, and it's an initiative that we started probably just over 2 years now, and it looks at a number of chronic conditions. I'm co-leading the group with Dr. Lynn Feehan on the arthritis and musculoskeletal conditions. And so what we're doing is looking at all the available online resources and programs around the world, focusing on BC and Canadian resources, though. And we've reviewed them all to see sort of what the quality of those resources are, what contributions, all the what we call stakeholders. So we're patients part of putting that together, we're clinicians, we're researchers, evaluating them, and then including just the best of the best resources.
Around the world.
Around the world, And so it's going to be a repository of resources for both patients to access. So if I have arthritis, I can go to that page just to look at what all the best resources are. There'll be some references for further information. And then on the other side of the website, there'll be similar resources for clinicians, because it's key that as clinicians, we bring it up all the time with our patients about being physically active, encouraging physical activity. So if we give it, and we also give the information to the patients, we hope that together that will result in a conversation about it.
Wow, well, that sounds like a huge project.
It is, yes, but it's been fun working on it.
I'm sure, and something super influential for both patients and healthcare professionals. Anita, is there any questions from our audience?
In relation to hip replacement, this is an email that we receive. This is a question we received in our email. this person has osteoarthritis and they've had one hip replacement done. What are the chances of them, and how do they go about getting that second hip replaced?
So it's not uncommon for people to have arthritis in both knees or both hips, and have to have a hip replacement, and then anywhere from 3 months to 3 or more years later to have the second joint replaced. Often the reasons they developed arthritis in the first place is affects both joints. So typically, an orthopedic surgeon would look, if they have arthritis in both sides, they would look at which one is worse or contributing more to their pain or their disability, and do the operation on the more problematic or painful joint first, and then give that person a period of recovery. For hip replacement, often it's at least 3 months, but typically at least 6 months to allow them to get some strength back, to have a good leg to stand on, and then to have the second surgery. But it really is up to that relationship with the patient and the surgeon to decide the timing around that second joint, and certainly a lot of people go ahead and have that second joint done as well.
And another question, what is your advice to a patient who is worried about complaining about the care that they're receiving?
Oh, that's great. So one of the things, and thank you for that question, that's one of the key elements of this toolkit that I'm developing, this Equip toolkit. It's not easy, as much as we try not to have a hierarchy and a power struggle when we're working with clients. It can be intimidating, and some health professionals are more intimidating than others, and often patients get quite intimidated when having conversations with their orthopedic surgeons. They're busy, they're powerful people, and they aren't sure about how to, if something's not going right, or they feel like maybe something, the care isn't as good as it can be, how do they say that in that relationship? Exactly. So one of the tools that we want to include in the toolkit, we're calling the quality conversation. So it'll be a video of a patient, and we're not sure if we're going to have a patient with an orthopedic surgeon or a patient with a physical therapist, because they're the primary providers of rehab, about that difficult conversation, how to ask questions, to be armed with the information in front of you, and so to feel confident to ask those questions, but in a respectful way that doesn't jeopardize the patient-clinician relationship. And so hopefully we can role model that through these videos, and it'll give people some tips and some skills on how to do that successfully without being intimidated. It can be a problem.
Absolutely. Yep. And I think, in those situations, having those printout sheets, as we were talking about, would be really good to be able to pull out that sort of passport size thing.
As a conversation starter. And it shows that I actually know what some of my rights are as a patient, and I know some of the expectations for my care, and could we talk about a couple of these on it?
What about this next step for that? Well, it's really great. Any other questions, Anita? Okay, well, thank you so much, Marie. We've really
You're welcome.
enjoyed having you here
My pleasure.
today.
Thanks.